I'm Elisa Sherman. I'm the CEO of Elementa, and this is our Women's Wellness webinar. Now, often I keep saying, this is not a webinar, it's a conversation. Well, this one happens to be a little bit of both. It's going to be part webinar with slides, and then we'll break out into conversation where we can answer all of your questions. If you're watching this live on Zoom, please use the chat box to ask your questions. You can also comment if you'd like or share other information in that chat box. We'll keep referring to it and checking in to see if you do have questions during the presentation, and we'll answer them when we can. Then toward the end of the slides, we will open it up for questions, and at that stage, we'll answer some more questions. Lots of examples to share, lots of information to share. So I really do want to get right to it. And this is where the slide portion begins. So one moment, please. If you're here for the talk about homeopathy, you are in the right place. We're going to focus initially on homeopathy in general, so you know what it's all about, but also a little specifics about how it can be helpful during the pandemic and just during stressful times. So let's begin. Our goal today, as with all of our presentations, is to empower you with better information about cannabis, CBD, and other health and wellness modalities for you, so you can be healthier. Typically, Elementa began as a cannabis and CBD education company, but we're talking about homeopathy now. So we wanted to expand our wellness education, because if you're interested in cannabis, chances are you're just interested in alternative and natural medicines. So that's why this topic has come up. And also, we want to introduce you to the Elementa Women's Wellness community. So let me do that really quickly. We hold events and we produce content to educate you from a female point of view about health and wellness issues, thinking about the way your life is in your 30s, 40s, 50s, 60s, and beyond. We're in major transitions as women as we age. That also means we're in major life stage transitions. And at the moment, we're all in turmoil and chaos, trying to adjust to what is unfortunately becoming a new normal that is nothing like any of us have ever experienced before. So we're here as Elementa, a community to educate and empower you, and we do that through the content. We can't meet in person, so all of our events are online right now. We also review product. It can be cannabis or CBD products, it could be homeopathy, or just general wellness products, beauty products. We are reviewing them from a real standpoint. You know, what is this really like? What is the packaging like? What are the instructions like? Is it clear? What are the ingredients, which is so important? And how do you take it? How do you use it? So we do try the products ourselves, and we will never write about it if we do not like it. But if we have something to say that you need to be aware of, we will let you know. But we do product reviews. We also offer discounts on products as well. So a lot of these companies are allowed to offer discounts. THC companies, not so. But all other companies can discount, and they offer that to you as part of our community. So if you subscribe to our newsletter, then you will be receiving these discounts as well. You can go to our website to read the product reviews. Okay, Boron. Did I say it right? I think
Boron. Mm-hmm.
Boron. For my whole life of knowing this company, which has been quite a number of years, early 90s, when I first went to England on business, and I went to Boots Pharmacy. I saw homeopathy for the first time. And this was a company that kept coming up. And so I've been pronouncing their name wrong all these years. But I actually do use some of their products all the time. And this is not even a commercial. By the way, they did not pay to be part of this. They're simply giving away some of their products. I wanted to make that perfectly clear, but they are a very reputable, longstanding company in the homeopathy world. And I personally will never travel and never be without easy access to oscillococcinum. Did I pronounce that right?
Yep.
I practiced pronouncing that for many years. So but it's a great immune booster. It's really meant for flu, but it can also really boost the immune system. So anyone with immune problems or somebody boarding a plane, except right now, if you're during the pandemic, I've always found it to be extremely helpful to me. So this is quite personal and quite exciting to have them supporting us with right now. So without further ado, thank you for bearing with me at that portion. Dr. Swathi, welcome back. It's so good to have you.
Oh, thank you. Oh, it's so nice to be here again.
So tell us a little bit about yourself. Obviously they can read what's there, but tell us what you'd like us to know about who you are and what you do.
Yeah, sure. So I'm Dr. Swathi Varanasi, but I generally go by Dr. Swathi. I'm an integrative health pharmacist and medical cannabis consultant based in the LA area. And I co-founded and I'm currently the only pharmacist in the US with formal specialized postdoctoral training in integrative health and cannabis. And so my training was specifically at an independent natural pharmacy as well as an HIV clinic. So I specialized in all the different modalities when it comes to integrative health and integrative medicine, and one of those is homeopathy. So when it comes to homeopathy, I had the opportunity to work with Boron on revising a manual for pharmacists. It's mainly for community pharmacists, the pharmacists that you see in the retail setting that are helping get you those medications that you need. So the manual has a comparison of the allopathic, so the conventional over-the-counter medications versus homeopathy, and how you could potentially use one or the other or both of them in tandem for those self-limiting conditions. So hopefully that'll be out soon, I think probably by the end of the year, so that a lot of pharmacists will have that opportunity and access to those resources. And I think it'll be an ebook, so then it'll be accessible to everyone nationwide. So that's really exciting. And it really goes to show that Boron is so committed to education. So as was mentioned, I mean, Boron did not sponsor this at all. They wanted to be a part of it, and they wanted to have a giveaway for one of the listeners. So it's just really something that they're passionate about. And then other things that I do.
I want to just quickly mention, if you are interested in that giveaway, just stay till the end. After we finish our Q&A, we will then bring up the winner. Okay, go ahead, keep going.
Yeah. Oh yeah, and I was mostly done. Just mainly other things that I've done on the side. So I taught 2 full courses at colleges of pharmacy and colleges of traditional Chinese medicine this past semester. And I'm also involved in research, so I'm currently finishing up a manuscript to be published and finishing up some review articles. Hopefully those will also be public soon. But overall, I'm just so excited to be here again. I'm really passionate about educating practitioners and students and patients all about integrative health and the possibilities for healing when it comes to that, the importance of nutrition and food, and how all of that comes together with the mind-body-spirit connection. So just excited to be here.
I love that, the mind-body-spirit connection, fully believe in that. All right, well, let's just dive right into the topic. So what is homeopathy?
The golden question. So Boron defines homeopathy as a therapeutic method that uses diluted substances to relieve symptoms. So later on, we'll talk about the manufacturing and what that diluted substances really means. So these active ingredients are from raw materials, whether that's plants or animals or minerals, and we'll talk a little bit more to that as well. And those are used to relieve similar symptoms that they cause at full strength. So it's the concept of like cures like, which as Western practitioners is very counterintuitive and confusing when you're learning it. Our students on rotation, we actually start homeopathy their second out of the 6-week rotation to ensure they have that full month to continue to ask questions and continue to get a grasp of it, just because it's so different from what we're used to. So an example of that is in those tubes that you saw in one of the other slides, those pellets, a very small dose of coffee bean actually helps relieve nervousness. And that is, you know, counterintuitive as you would think, because a high amount of caffeine or high amount of coffee can cause that nervousness and agitation. So yeah, we'll talk more to that, and hopefully I can help chat about homeopathy and really alleviate some of the confusion and answer your questions. All right, next slide. All right. Okay, Yes, so the raw material. So as I very briefly mentioned, the raw materials can come from all types of origins, but they're generally all from natural origins. So for example, there are minerals, and so some examples of those are copper, arsenic, and zinc. And there are also vegetable and herb origins, so that's like black cohosh, for example. And then there's also animal origins, like there's one that comes from the honeybee called Apis mellifica. And there's also some as well from chemicals and drugs that we're a bit more familiar with, like aspirin and nitroglycerin. So really, there's quite a variety of the raw materials and where it really starts before the entire manufacturing process that we'll get into. All right, next slide. Okay, so overall, I talked a little bit about the raw materials, so I'll go through next and talk about the 3 steps that the homeopathic product has to go through. So initially, the raw material needs to be transformed into a liquid. And so substances that are soluble, like a lot of plants, they can be macerated with alcohol and water for 3 weeks. And that's done in specific proportions. That's, of course, proprietary to whichever company we're talking about. And so maceration means that it's just very deeply soaked. So it sits in that alcohol water solution for 3 weeks. Then after that, that resulting tincture is filtered. And so it undergoes a series of tests and controls to verify that it has the qualities that we're looking for in the substance. So I talked about soluble substances, but there are also some substances that are insoluble, like some of the metals I was talking about, or some of those raw materials, so like silica and copper. So they undergo a little bit of a different process. They're first diluted in lactose, and then there are 3 successive 1% dilutions, each followed by a vigorous trituration. And so that's one of the homeopathic terms I wanted to go over. So trituration is when you're taking a mortar and pestle, that's one of the methods to triturate something, and you're really grinding it down to the smallest possible pieces, almost into a powder. So once those insoluble substances have gone through those 3 dilutions, they've been triturated, then they're dissolved in water. So now at this point, we know insoluble and soluble and how we get to this step. So the entire process is validated to ensure that the original substance still has therapeutic value and what we're looking to get out of it, and that it's present in the liquid phase. So then after that, it's diluted to the appropriate level, and I'll talk a little bit about the dilutions on the 2 scales, the C scale and the X scale. And then later, that's incorporated into the pharmaceutical formulation. So I'll talk to that as well. So the pellets, there's tablets, suppositories, all types of things. So once it is diluted to that point, then it goes through the process of becoming that pharmaceutical formulation that you'll see on the shelves. And a big thing about the manufacturing process is that there are good manufacturing processes, like the GMP standards that are set forth by the FDA, and homeopathic products, and every company that's on the market that you'll see, it's really important to know that they do undergo all of those audits by the FDA, and they have to have a very specific process, and it has to be very clear. So it does go through a lot of very rigorous, that entire rigorous manufacturing process. All right, next slide. Okay, so now we'll talk a little bit about the dilutions, yes. So the dilutions process is really specific to homeopathic medications. As I said, it's very controlled and highly validated. And really, they do that to ensure that the medication is going to have that reliable effect that we're looking for. And also to ensure that the process can be recurrent, repeatable, so that a lot of the other formulations that are made of the same product will be nearly the same. I don't want to say exactly the same, but nearly the same. And so through this dilution process, it's a recurrent process that involves 2 steps each time, one after the other. So dilution and then succussion. So succussion is that vigorous shaking. I wish we had a video. That would be really great to see. But it's this really vigorous shaking, and it's called succussion. And this step is essential for keeping the therapeutic effect of the dilution. So yes, it is diluted, but the succussion is the key step that keeps that therapeutic value that we're looking for in the substance. So as I mentioned before, very briefly, there are two scales. There's the C scale and the X scale. The C scale is the 1% dilution. So if it is a 1C, for example, it will go through a one-time 1% dilution. But a lot of the different formulations that we'll talk about are like 6C and 9C and 30C. And that means that it's undergone that 1% dilution that many times. So 30C will have gone through that 1% dilution 30 times. So there's very, very little of that active substance at the end when it's so thoroughly diluted. So that's a C scale. And then the X scale is the 10% dilution. So that is, again, if you see products like 2X or 10X or 50X, that means that it's undergone that 10% dilution that many times. Great. And so another thing with the manufacturing that as a pharmacist I think is really great and something that I can relate to is that it's done in a laminar flow hood. And so that means that there's only very clean air in the hood, and the hood is very well cleaned to very high standards with pure water. And this means that there's a very low likelihood, or the goal of it is to have a very low likelihood of contamination. And so as a pharmacist, you know, when we're learning in school, or a lot of pharmacists that work in compounding pharmacies, they're doing a very similar process in creating and compounding those pharmaceutical agents. Instead, we're just talking about homeopathy. Great. And then after we undergo that process of dilution and succussion, however many times we need, and then I mentioned it's formulated at the pharmaceutical grade, like what we're used to. So the most common types that you guys are probably familiar with in the cylindrical tubes are those round forest pellets. They're mainly made of sucrose and lactose, and then of course also has the active ingredient in it. And those are used for sublingual absorption. So that's put under the tongue, and you just let them dissolve under the tongue. And then there are also other formulations like eye drops and tablets and gels and creams, syrups, suppositories, ointments. It comes in so many different formulations depending on the company. So yeah, I really wanted to make sure that everyone understood that the manufacturing is so well defined, and they need to ensure that it is repeatable for the future to have that level of standards. Next slide. Great. So the possibilities of homeopathic medicines. So they can be used to treat chronic and recurrent conditions. They are most effective when given at the onset of symptoms. So if the patient is starting to feel that symptomatology for like flu-like symptoms, which we'll use Acilo, that's on the slide right there. It was just mentioned before. So it's most effective when given right at the onset of symptoms. So it's great to have, like as was mentioned before, to have in your purse or to have with you, because if you start feeling a certain way, then that's the exact moment that you want to start using it. And then it can be used alone or to complement other allopathic medicines. So that could be over-the-counter medications. It could be other medications too, like the prescription medications that many people are taking. And so you're able to use them in tandem. And I'll talk to you as well how there's very, very low risks of drug interactions because of how minute and dilute the active ingredient is in the formulation. And they're also very well tolerated for that reason. So I think information like that is really important. And I like that also on the slide there is that example of Acilo, is what I call it for short. And that, as it says on the formulation, on the product, on the box there, that it can treat flu-like symptoms, so body aches, headache, fever, chills, fatigue, all of those. And that very much relates to what we're talking about today with everything going on with COVID-19, and that being a potential option for patients if they are feeling those type of symptoms. So apart from that, I do want to talk about dosages. I talked to you a little bit before that there is a range generally. So like the 2X, the 10X, the 50X, or like the 6C, the 9C, the 30C. And so you use the different dilutions depending on the symptomatology. So you use the less dilute, so that would be like your 6X or your 3C type of a thing. Oh, sorry, I flipped those. Your 6C or your 3X. You would use those if there are only a few symptoms that are very localized. So that would be like a joint pain. It's right in that specific area. Maybe I should point to a joint. It's right in that specific area. And you can point to it. That's generally how we teach the students, is that you can point to it. And that's when you know to use a less dilute. So that's just a lower number. And then when you use a more dilute one, so that's more of like the 30C or 30X we're talking about, that's when the patient has many symptoms that can be local, general, meaning it could be all over the body. It could be anywhere. It could be 2 places on the body. It could be more than that. But also the other element is that it can impact the behavioral processes. So that's when you start feeling confusion, or you start like, I think confusion is a really great example, but also lethargy and stuff can also fall into that category too. So the higher the number, we're looking for many symptoms that are not localized, that could be general, and also could be impacting the mind. Great. And so a big question I get when it comes to this is potency. And so I think that also comes from that Western mindset of thinking, okay, I'm taking 10 milligrams and then I'm going to take 50 milligrams and it's more potent. But that's not the way homeopathy works. So a 6C is not necessarily more potent than a 30C. It's just a different level of dilutions, and it's used for different types of symptoms. So we look at it more in like the qualitative sense rather than looking in the quantitative sense and just like upping the dose to make it more potent. If that doesn't make sense, I can definitely explain that more, because that was something that took me a long time to wrap my head around, because it's very, very different from what we're used to. And then the same goes with the frequency of dosing. So a lot of the time with pharmaceutical agents, we're used to you take it however many times a day, and that's what's been set. But for homeopathy, it really depends on the intensity of the symptoms. So the intensity meaning if the symptoms are really intense at that moment, if they're very severe, then you're going to take the formulation a bit more frequently. So we say if it's very intense, you start with 5 pellets, even every 15 minutes, every hour, depending on how frequently you think you need it. And then if it's less acute, then you take it less frequently. So you can take it every hour, every 3 hours, 3 times a day. It just depends really what the patient thinks is best. So you're giving the power to the patient to help them heal themselves. And really, they just decrease taking it until they feel better, and then they don't need to take it anymore. So it really just depends on what exactly you're treating and the patient themselves and how they're feeling with how frequently they take it and how long they end up taking that formulation. So it's very, very personalized. It's highly individualized. And I've seen that many a time working at the pharmacy. So the pharmacy where I was for the past year, there were all sorts of practitioners that worked there. So there were homeopaths, nutritionists, herbalists. And so I got to see and really understand the homeopathic process, seeing homeopaths interact with some of the patients that came in, and seeing, depending on different symptoms, or if something, was worse in the morning, or if it got better with heat or got better with cold, or was better at rest, or rather in motion, and how that can change the exact formulation, and it can change the exact substance that you're going to be treating it with. I hope that wasn't too much information in a short period of time, but there's just so much to share. Okay, so that was a lot of the advantages, a lot of the pros that I went through, but there are also some limitations. When it comes to limitations, first, the condition has to be reversible. So what that means is you can't use it and expect to be cured from like type 1 diabetes, because you're born without the use of the insulin, right? So, I mean, you can't use it for ailments like that, but it's reversible, like flu-like symptoms, like a cough or a cold. It's great for things like that. And the patient must also be capable of reacting. And so what that means is if the patient is very overwhelmed with so many things going on in their life, or if the condition itself is too debilitating, so meaning like it's not really a self-limiting condition anymore, then perhaps another modality is better. Maybe in that case, a pharmaceutical drug is more appropriate, or maybe they need to see an herbalist or some other specialist for another modality, because homeopathy really wouldn't be the best choice in that scenario. All right, next slide. Okay, so advantages. I spoke to a lot of some of the advantages prior, but then also on this slide too, just harping on the fact that there are very, very, very low risk of side effects as well as drug interactions. And I think that's really attractive to like an integrative health practitioner, because we see a lot of patients who, for example, are taking a lot of like cancer medications. And so those medications have a lot of drug interactions and could have a lot of potential side effects. And so pairing that with something like homeopathy, for the most part, we feel pretty comfortable doing that. And of course, I should mention that side effects are possible, but they really are quite rare. And that's generally with formulations that are more dilute than 4C or 8X. And so that means if the number is higher, so if it's like a 10C or a 30C, or like a 15X or a 30X, those are the ones where we're not going to be as worried, and we would be comfortable giving them to someone who is undergoing cancer treatment. And then another big question is like pregnancy and breastfeeding. So there have been studies done on homeopathy, which is a big misconception that there aren't. There definitely are studies, but not enough studies with pregnancy and breastfeeding. So that's very clinician specific and up to clinician discretion whether they want to recommend it. When we're in the pharmacy, we generally do not do that. Just for liability reasons. But I mean, it really just depends on the clinician and what they're comfortable with. And of course, it's very patient-centric. So certain patients, of course, wouldn't be candidates for this treatment because of other situations going on in their life. And then that brings up the risk versus benefit. Where it's like evaluating the studies that are out there, but then the clinician deciding, does the benefit outweigh the risk? And that's really the goal. If the benefit can outweigh the risk, then it could be a great option for that patient. And as I went over the low risk of side effects and the low chance of drug interactions, I mean, the benefits really do outweigh the risk for a lot of patients. Another thing that I get asked about is when moms come in or dads come in and they are wondering the formulation and the dose that's appropriate for their child. And so when it comes to homeopathy, it's not based on the person's like body chemistry or their weight, or so regardless of their age and their body like composition, it just really again comes down to the symptomatology and the patient themselves. So we're not really like, when we're evaluating the patient, we're not asking that like typical demographic information that you'd be used to asking with like, okay, what's your BMI, what's your age, like those types of things. It really comes down to what we're trying to treat. And then as this slide says again, so it's great to use as a complement to allopathic therapies just because the slide's not fair. Yeah, it's great to use as a complement to medications, and it can be used with a lot of other modalities and works really well with other modalities for a lot of these reasons. All right, next slide. Okay, so how are they regulated? I hinted at this a bit before, and I talked about the manufacturing processes and how they do have to abide by the GMP or good manufacturing processes set forth by the FDA. And these are the same types of processes that FDA drugs have to, FDA approved drugs have to go through. And so something, if I had a product near me, which I don't right now, which I should have, but the products themselves, if you turn them around to the other side, they say drug facts. And that is because they're regulated like drugs by the FDA. In contrast to that, dietary supplements, when you turn them around or you flip them around, depending on where it'll say supplement facts. So that's very, very different because those dietary supplements are regulated by the FDA and the FTC, but not the same standard as homeopathic medications and the pharmaceutical medications that like the prescription medications that we're used to. So I think that's really important that they are very highly regulated, and companies put forth a lot to ensure that their processes are up to the right standards and can undergo those audits and go through them successfully. All right, next slide. Okay, great. So now we are talking about, now we're talking about, so in the time of heightened stress and anxiety and everything that's going on right now, I'd love to open it up for questions if you guys have specific questions on what can be used for like fatigue or anxiety. I have a short list here of ones that I feel like we recommend with quite a bit of frequency. And so that's like gelsemium, for example, that is used quite a bit for body aches and also anxiety. Body aches, another great one is arnica, and arnica comes in a lot of different formulations. So if the body ache is local, then you can use like a cream or a gel that works super duper well. I use it all the time after working out, actually. And then there are also other really great ones. So for fatigue, we recommend phosphorus. That's a really popular one. There are quite a few for cough, and of course cough, whether it's dry, whether it's wet, and then the other different patient-specific aspects that will really help us figure out what the best formulation is, what the best substance is for the patient. Yeah, so I'm very excited to take questions. Let me know anything you want to know. I know it's a lot of information in a very short period of time. I just was trying to narrow down the information. There's just so much that's what I narrowed it down to. So just let me know if I need to go back to a slide and re-explain it or explain it in a different way.
That was amazing. And I apologize for the slide hiccup at the very end.
No worries.
That was a Zoom thing. All right, I'm going to double check and see what questions we have. And you are breaking up a bit. I wasn't able to say anything because I couldn't unmute myself while the slides were up. I was trying. Yeah, so I don't know whether it's just, is it a phone or... It's okay.
It could be a phone thing. Oh, no.
Yeah, that's okay. You sound really great now. Just so
Okay.
it'll be perfect for the Q&A. So if she was breaking up during a point where you have a question about, feel free to ask that in the chat. But here is one question. Does homeopathy cause a reset on a molecular level? Oh my gosh, this is really complex. Okay, does homeopathy cause a reset on a molecular level on genetic pathways for better uptake with other substances, such as CBD? Could you explain the question?
Very interesting.
Yeah, before you get into the answer, explain that question too, because it's a little bit complex even for me.
Yeah, so the way I'm interpreting the question, please let me know for the person who answered if I'm not interpreting it correctly, but the way that I interpret that question is, if we're using homeopathy, can it actually help and like have a synergy with other medications or other modalities? And I think that person was specifically asking about CBD. So as far as I know, I don't know. I would love to know. I'm sure that's something that's been looked at, or that is like, there's a current ongoing study with that. I think that there is a high possibility, I just don't know. And then when it comes to the way homeopathy works in your body, it really, like what we say to students, it helps remind your body of certain functionality. So you're using it to like kickstart a normal process for your body, rather than taking a pharmaceutical agent that is like blocking something that is, an unnatural process for your body.
Oh, that's a really good way of putting it, because when you do take a lot of medications, it is a block, it is a mask to hide the symptoms so that you don't have the pain or you don't have those symptoms, but it's not getting to the root of helping your body heal. And that's how I've always understood homeopathy, is that instead of masking and hiding it, you're putting your body through its natural paces, like putting it through the paces to bump up and elevate that response to healing or to literally getting to the root of the problem. So
Yeah, that's exactly how I'd explain it too. And
Okay.
a lot of practitioners also really like it because, for example, if there's like a side effect from a medication that causes like an electrolyte imbalance or something like that, then that's avoidable if you use the homeopathic rather than taking the medication. So it also kind of helps with those unwanted effects too.
Okay, interesting. A question about bee propolis. Is that how you pronounce it? Bee propolis, because I've actually taken that before. I was wondering what that is used for and if it's typically effective, and what kind of counseling would you give to patients about bee propolis?
That's a great question. I'm gonna look into that and get back to you because I want to make sure I give you the most like perfect, extensive explanation for that. So if you don't mind sending me that question.
Yeah, I'll send it to you. Is that homeopathy though, bee propolis?
So I think there is a homeopathic formulation of it, but it also, I think, comes in other formulations that are not homeopathic.
Right. So
I think there's more than one way of taking it.
Yeah, I've used it as an herbal tincture. And I've used it as an herbal tincture as part of an immune boosting process, and particularly around throat issues. When I had laryngitis, I was prescribed it. When I had some recurring tonsillitis, I was prescribed it. So that was my understanding. I've been seeing homeopathic doctors, oh gosh, and naturopaths who prescribe it since the 80s. So yeah, so that's what I remember having used it for. And
I definitely knew it was something with like the nasal passages and cough, but I wanted to make sure before I said the wrong thing. Yeah.
Okay. So fatigue is a big thing for one of our listeners here. So what's the name of the treatment again? Could you spell it? The one that can address fatigue?
Oh yeah, there's so many. Well, I can talk a little bit more to fatigue actually, if that's of interest. Yeah. So, okay. So there's phosphorus. That's the one I think that I mentioned beforehand. And so phosphorus is generally used if there's any sort of like pulmonary involvement, so anything to do with the lungs. And it also is really great for anxiety. So if there is any sense of anxiety and if there's any sort of like pulmonary pathology, I think that would go really well with fatigue and phosphorus. And then there's also phosphoricum acidum. So it also is similar to phosphorus.
Say that one more time. I'm going to try to spell it for me. What was it?
Oh, phosphoricum acidum.
Phosphoricum. Okay, this is acidum. ACIDUM.
Yes.
Ta-da! Okay. Sort of.
And then so that can be great if you're having issues with sleep. That one is if you're like waking up and you have like heat sweats. I think that's the one that's generally the turn to for that. So I think that also goes with anxiety too, if that's how your anxiety is manifesting.
Okay.
And then, so those are two. Yep.
Oh, okay. Oh, go ahead. Did you have anything more on the fatigue side?
Oh yeah, I was gonna say cinchona is the other one, or people pronounce that differently, but I say cinchona.
And you spell it how? Hold on. How do you spell?
Oh yeah, so CINCHONA.
Okay.
And so that one is fatigue due to being so physically exhausted, like physical depletion. And so I think that would be great if you're like moving right now, like I am, and there's a lot of boxes and all of that. I think something like that would be really, really good when you're doing a lot of like physical movement and like movement that's hard on your body.
The thing that I really appreciate about homeopathy too is that besides not masking symptoms and really getting to the root, is that it understands there's such a huge body-mind connection. And so many of the things that, so fatigue could be paired with anxiety. Fatigue could be paired with depression. Fatigue could be, so anything that you're experiencing and feeling, or anything that is a condition that you're dealing with comes with feelings. And so depending on the formulation, depending on what you're using, it addresses both sides of it. Because someone with cancer and going through cancer treatments, they're going to be experiencing a tremendous amount of anxiety. It's not
Mm-hmm.
just the nausea or the lack of appetite, but it is the emotional component. And so I find homeopathy to be so complete in that way. It's very appealing.
Definitely. And I really like that homeopathy looks at things in a bit more holistic standpoint. So if like fatigue, for example, that could be the root of the fatigue could be anxiety. The root could be another condition. And so I like that it looks at the root, and then it really takes into account all the different factors from the patient before giving them a medication. Because for fatigue, I mean, there's so many. I just mentioned some of the most common ones, but there are so many that could be used depending on if the patient's also feeling other things.
Well, and then that's a really interesting point too, because I have firmly believed that a lot of the physiological things that we are experiencing, particularly pain and chronic pain, the root may not be entirely or even be physiological. It could be a manifestation of emotion. So I do know.
Exactly.
Yeah, when my father died and I was experiencing tremendous traumatic grief, my hips hurt very badly. And now I notice that when I'm in a grieving period, and it's not just loss or death, but it could be a grieving because of just severe stressful situations. The pandemic itself, every moment you read the news, you are in grief, deep grief.
Mm-hmm.
My hips are hurting again, really badly. And so that's something to keep in mind. Often we say, I've got a headache. Oh, let me take some aspirin. We don't think, wow, the stress of that situation is causing my headache.
Mm-hmm.
So
exactly.
And then
And
again,
so many modalities to attack headache too. Like, are you dehydrated?
Right.
Like that's another great thing too. So like looking at the nutritional aspect, I think is just so important. And something I'm starting to look more into now is nutritional psychiatry, which I think is so beyond fascinating. So I think that also ties in really well to what we're talking about.
Yeah, for sure. When we were talking earlier with the question about, is it possible that homeopathy can sort of work in synergy with CBD, for example? The person who had asked the question was looking for that synergistic effect and was talking about the idea. So we understand cannabis and CBD, the cannabinoids within the plant, as helping to bring us into homeostasis because it's affecting our endocannabinoid system. So is homeopathy similar in a way to bring us into a homeostasis? Because it seems to me it's really what it's doing is kickstarting, like you said, kickstarting processes that are part of our natural healing features that the human body has, as opposed to regulating and harmonizing. Is that correct?
Yeah, that's a really interesting take, actually. So I think with homeopathic medications, like the formulations, it really depends on what the patient is taking, because what the patient is taking is kind of targeting a specific, feeling, emotion, like host of symptoms. So I wouldn't say necessarily it's for homeostasis in every single context, because I think it depends on what you're trying to treat. Whereas with the endocannabinoid system, that is all about homeostasis. So I think that because the endocannabinoid system links to so many other processes and organ systems and everything in your body and your mental state, that I think that that's a bit more of the homeostasis. But I do see the parallel. That's really, really interesting. I've never thought about it like that.
Yeah, and I would think they would be complementary in the same way that there are so few contraindications with medicines, because cannabis and CBD are essentially medicines or supplemental to health, that there would be less negative interactions as well. It seems.
Oh yeah, definitely. I would not expect any drug interactions, maybe like 0.0001%, like very, very, very low likelihood. I don't want to say zero, but I would expect very little to no interaction between like a cannabis product and CBD, or sorry, cannabis product and homeopathy.
Right, so cannabis or CBD, which is a derivative of cannabis, and homeopathy. Got it.
Exactly.
Let's go back to the like versus, is it like versus like, or like and like?
Like cures like, yeah.
Like cures like, because that has always, I mean, even from the start, you're right, you have to fully shift your entire mindset, everything you know about traditional Western medicine, over-the-counter drugs, pharmaceuticals. The like cures like idea for me, I finally had to simplify it down, and I think you did a great job explaining on it, and I'd like you to elaborate again, but here's my take on it, is if you have a fever, you take something that essentially causes a fever. And what it does is it speeds up the heating of your body, because fever fights germs. Fever is your body's way of fighting the bad stuff. And so if you push it a little further, you got more heat, you got more curing. So tell us a little bit more about the like versus like, or like cures like, because it is so different for our normal Western medicine thought process. Yeah.
I think you did such a good job explaining it. That's very similar to what I would say, honestly, because it really is taking something that, and I mean, it is so counterintuitive, because you wouldn't think like, oh, I have a bee sting, so let me treat it with like a substance that came from a honeybee, you know, like you wouldn't think of that initially. But it's really, as we were saying before, like reminding the body, like kickstarting those processes again of how the body can heal and how the body can kind of combat anything that's going on. And I really like that homeopathy does that on such a multi-level approach.
Yeah, other thing that I always found kind of strange and a little scary, and it took me a while to get used to this. And again, I've been using homeopathy now, gosh, 20, I mean, how many years is that? I don't know. I can't even do the math. Many years, since the 80s, since or late 80s, early 90s. Okay. Is some of it is poison in other forms? So arsenic, belladonna, that used to scare the daylights out of me. Tell us about that, because you say arsenic and I'm going, oh my God, I still get that visceral reaction, but it's not poisonous. So how?
Exactly. It's because it's diluted so much to the point that there's such a little bit of that active substance and active ingredient that is in the homeopathic medication that we're not really worried about drug interactions or it having some sort of toxic or like negative effect in the body, because it's just so minimal, and you would need to take a lot more of the arsenic or belladonna or anything to really see the negative effects of it.
Okay. And so there is a lot of getting used to understanding the new terminology, understanding the dosages, the frequency, and then having the confidence that what you're taking that you would immediately register as poison is absolutely not toxic. It's a lot of relearning, and yet again, I feel incredibly comfortable now turning to homeopathy, adding homeopathy to any of my treatments for anything else I'm doing. Always, though, ask your physician, your healthcare provider, your primary care doctor, even if you're adding in homeopathy, even if we are all saying, and we all have the understanding that there's few contraindications. Never take anything new. And that means never change your diet, never start exercising if you've had problems in the past. Never make these major changes without talking to your physician.
Exactly. I think that's so important. So, and even expanding that as well to your pharmacist, because your pharmacist is the one that's going to be like dispensing the medication, ensuring that the medication was written correctly, if there are any interactions with the other medications that you're taking. And also, they're the ones that are there on like every street corner that'll be able to answer your question. So it's probably a lot easier to reach them than it would be your primary care.
Such a good point too. And I have to say, I have never really been in a good habit of turning to my pharmacist. And in the kind of old days, that is who you would always speak with, is your pharmacist. So I think having a much better relationship with your pharmacist on an ongoing basis is such a good idea. Said really to the pharmacist.
So yeah, I know. I mean, I of course agree, but I think also it's just the way pharmacy has become so commercialized with like all of the companies coming through and, you know, all of that. So I think that has kind of gotten in the way of what the pharmacist has the capability to do, and really what we're educated to do in school.
Yeah, I think it's such a good point. Jenny has a question, and this is a good one, and I think I want to clarify a little bit based on her question. She was asking about CBD homeopathic products. As far as I understand, there are none yet. There are none. So when we were talking about CBD products, we were talking about separate CBD products and the idea of homeopathic products being used in concert with. So I just wanted to clarify that, just because of the way the question was phrased. But she's not familiar with CBD, and she wants to know what's the most helpful for pharmacists to know and share with their patients about CBD and homeopathy, using it together. And you're the perfect pharmacist to explain this, since you are so well versed in cannabis and CBD. So just let's make sure we do first clarify there's no such thing as a product with both. And so therefore, using them in concert, what does a pharmacist need to know to tell somebody who has come in and ask about this?
Definitely. So I think that was a distinction I should have made earlier on in my talk, or in my lecture earlier on in the slide decks, that the word homeopathic gets thrown around a lot. It gets used in a lot of different contexts. And I think, like, even so, for example, the pharmacy where I was working, the term homeopathic is in the title of the pharmacy, but only about 20% of the products were actually homeopathic. It was just used to attract customers. It's always had that name because, like, people use it in that capacity, or that they use it in that way. It's just very like casually used in that way. So I think that it's very easy to confuse and think that there could be like a homeopathic CBD product, because that's the way that we're used to talking about it, is that, it's a product that isn't pharmaceutical grade, or it isn't like a prescription medication or an over-the-counter allopathic that we're used to. So yeah, that's such an important distinction. Another, to go with that, there's a little bit of a tangent, but another thing though is that, like with Arnica, Montana, for example, we get questions quite frequently about the homeopathic formulation. And so we need to also talk to our patients and ask them, so do you mean the homeopathic one, as in the one that could come in the tube with the cream and then you could put it on your body? Do you mean the ones that come in the tube? Because those are homeopathic. But there also is like herbal forms of Arnica that you can take that come in capsule form, that come in the actual, herb form. So that's a really important distinction too, is just making sure you know exactly what your patient is asking you. So really important.
Okay.
And then when it comes to the CBD question, so if we're talking about using like CBD and homeopathy together for the same patient, I think, as I said before, I'm not really worried about drug interactions. And I think that really comes down to the patient and like patient-centric care. So what we call that is like patient-centered shared decision-making. And so that's like laying out all the potential options that could work for a patient depending on their other drugs that they're on, other diagnoses, their lifestyle, and what their treatment goals are overall. And looking at all of those and saying, so there is a homeopathic option that could work for you if you think it will suit the patient, judging by their anxiety, for example. And then also, if like a CBD product could be a great option. A lot of the CBD products, like I think broad or full spectrum is the way to go. But I do think that there is like opportunities for great relief from anxiety as well from CBD. There are the herbal products like Eastern and Western herbs. I think essential oils could be incredible, or therapeutic aromatherapy specifically could be amazing for anxiety. I've recommended that quite a bit to friends and to patients recently, especially in the last few months. And that's really been helpful. And we've had people come back and say that it really works for them. And I mean, that's the like most flattering and satisfying, gratifying thing that you can hear, is that, wow, your recommendation actually helps me fall asleep now, that type of thing. So I think it really just comes down to the patient. And as the practitioner, your goal is just to be as educated as possible so you can present all the different options that are available, because there just really are so many.
All right, excellent. Well, we are coming to the end, and I wanted to pick our winner. So it's just so everyone knows, I use a site called random.org. I put in the total number of participants present, and then it pulls up a random number, and then I look at my list of participants, and the winner happens to be Amanda Roberts. So Amanda, yay! Amanda, you have won a basket of Boron products, which will be mailed directly to you from the company. So therefore, I'm going to need your address. There's one way you can do it now in a chat if you wanted to, and that is make sure that when you go into chat, choose only panelists. Only panelists, so that we see it privately. You can type in your address there, or I'm typing in my email address, aliza@elementa.com, and you can email me your address that way. Whichever's easiest for you, that's totally fine. So congratulations, Amanda. You have won the Boron basket of wonderful products. So,
so many products. I was talking to the coordinator about this. He's a national pharmacy educator. So Boron even has a national pharmacy educator as a position. It's amazing to me. So I was chatting with him, and it sounds like the gift box and gift basket is pretty amazing. So I'm excited for you.
I have to say that one of the first ways I began trying all their different products is I was at a blogger conference, and I won a random drawing of a basket of products, and it was the most immense, amazing thing with all sorts of products for everything from PMS to restless leg to it was mind-boggling, and it was like Christmas over and over and over again. It was just such a beautiful self-care kind of gift, and that was my first major introduction to just the breadth of products that they have. And it included an arnica cream, and it included lots of different pellets, the little round pellets. And anyway, lucky ducky. Amanda, fantastic. I'm not going to go back to any more slides, which we typically do on a webinar, but I just want to say thank you for this incredible amount of information. You helped me sort of fill some of the gaps that I even had on homeopathy. But I do personally believe that it is a helpful addition to any wellness plan, any health care. I'm a real believer in it, and I'm proof that it works on so many different things and so many different levels. And I appreciate the knowledge you bring, Dr. Swathi. It's always great to have you. I can't wait. Let's think of another topic and have you back. And I just wanted to say to everyone who has been watching live, thank you. For those of you who are watching the recording afterwards, let's hope you're not still in the throes of a pandemic. Let's hope that we've got things under control. But there are so many things that you can turn to feel better. And here at Elementa, we go out of our way to find the experts and the authors of the books on those topics of wellness where we can take care of ourselves and take care of our loved ones. How do we find you online, Dr. Swathi?
Connect with me on LinkedIn. I'd love to chat more about this. If you have any specific questions about any of something that you want to include in your regimen, or something for one of your friends or family, please let me know. Love having conversations like this. So yes, find me on LinkedIn. Otherwise, my email is my first name, which is right in the little box there. So SWATHI at Dr. Swathi, so DOCTOR SWATHI.com. And then my website is also drswathi.com with doctor spelled out. Yeah.
Okay, excellent. And then you can always find us at Ellementa, ELLEMENTA.com. And if you go /events, that shows you all of our upcoming events. We are holding these events every Wednesday and Sunday at 12 noon. So thank you so much. And we will speak.
Oh, thank you for having me.
We will speak soon and again. And everybody, thanks for being here.